guys, it's Finn. Yesterday I had my appointment with Dr. Christopher, the Andrology team in Harley Street in London, excuse me. And I thought I would just talk about that and where my head is. I have no idea where my head is. Dr. Christopher was really lovely. He was really good at kind of talking me through the procedure for both meta and for fallow, what would be involved at different stages and different procedures and what have you. There's a lot of information. My biggest issue is standing to pee. That is where most of my uncomfortability lies. And really and truthfully, I'm not going to be standing to pee with meta. I haven't got a huge amount of lower growth. It's not ginormous. And so the likelihood of me having much to grab hold of to be able to use it successfully at a urinal is quite slim, really. And I think I kind of knew that. But yeah, I was kind of hoping he'd be like, oh, I don't know. You got a dong down there, you'll be fine. With fallow, obviously you've got the option of standing to pee quite happily with a fully fledged fallow, or we did also speak about the option of doing a smaller fallow, about 10 centimetres he said, and the deal with that is because the arm scar is what's bothering me with fallow. They could do a much smaller arm scar. They'd actually move it away from your wrist, because a lot of people have problems with it, cut right around the wrist, that a lot of wrist movement is sore or painful, what have you. With doing a mini kind of fallow, it's taken from slightly lower down, so your wrist skin remains around there. And obviously just less of a scar because it's only 10 centimetres. So I would just have something I could grab hold of. It would just be like a small male flaccid penis. Obviously there would be no chance of penetration with that because you wouldn't be able to have a rod. You could probably, I don't know, I need to look into this, but with the sheaths that you can use to give erections, you could probably do it without. I mean, the peacock I use is 4.5 inches, so that's roughly about the same. But the advantage of that is I'd have less of a scar and still be able to have something to stand to pee. But then on the way home with that, I was saying, you know, if I'm going to go through the routine of having a graft taken there and then the remaining graft from under my ass to be put back on there, if I'm going to go through all of that just to stand to pee, is it really worth it? If I'm going to go through all that, I might as well go through all that so that I can stand to pee with a fully sized penis. I don't see the point in going through all that to not have. I really just don't know what to do right now. I'm just overwhelmed, and so I'm just going to keep making videos about how I feel, because, you know, I've shared it with people and people have been incredibly helpful in sharing their thoughts on how they decided whether to have surgery or not, or which surgery to choose, if they were going to choose, because I don't know. You see, I think it's also really important to make these videos because in asking questions, I am finding a lot of people are kind of the attitude of, well, you don't know, so if you don't know, that kind of suggests that you shouldn't go ahead. Why? Because I'm questioning? I think that's a very, very dangerous attitude to have in our community, actually. I think this is extensive surgery. Anything we do to ourselves as part of transition is extensive. Putting testosterone in your body as a hormone that it wasn't born with has its dangers. So does top surgery, so does lower surgery. This isn't a decision that should be taken lightly at all. This is something that should be questioned. And I just think it's just not good in our culture that we can't kind of say I've got fears and be met with kind of like, oh, okay, let's talk about them. Not, oh, this can't be right for you, you know. So I'm sorry, I'm just going to get on my high horse about that for a minute. Because I just want to make sure I'm doing the right thing for my health, physical health, and my mental health. You know, it's a year, at least, of intensive operations, of of pain, of disability throughout that year. That's a lot to go through. I mean, okay, I guess some people's dysphoria is so bad that there's no question, they just have to do it. And I think maybe my need for a penis is less than some people I've met, you know. It's like chest surgery. Some people are so dysphoric that they would just go in without even researching. And that was where I was with chest surgery, really. I mean, even if someone said to me, look, I'm sorry, but there's only one surgeon available to do it now, and he's really bad at it, you'll have really thick scars, they'll end up kelioid, and your nipples will be in the wrong position, I'd have gone, that's fine. Anything just to have a male chest that I could put clothes on top of would have been fine. You know, that's how bad my dysphoria was. So I do understand that there's different degrees of dysphoria, and so you have to kind of weigh it up, really. But it doesn't mean if you're questioning that it's not right for you. Get off your soapbox, Finn. Okay. So yeah, my issue, you see, is more really that I want to stand to pee. I hate, and I know a lot of guys sit, but I don't like when you go into a toilet and there's 15 urinals and one cubicle, and I'm stood for the one cubicle, and someone's having a dump, and I've been in there 10 minutes, and people are coming in and out, and I just feel so awkward, you know. I hate that. Having the peacock has helped a lot, because I can use urinals, but some of them are too high up. And also some of them, if I'm away from my hometown, I worry. If I have an accident and I've not got anything spare to change into, what am I going to do? You know, so although it has helped in the majority of time being able to use my peacock to stand to pee, it hasn't eliminated that awkwardness I feel in toilets. And I want that awkwardness gone. And it would be an additional bonus not to have to use something fake to pleasure myself in that with. It would be good for it to be my own. So I don't know at the moment. I've got to sit and work out and balance my risks and my wants. I think, if I'm honest, if I was younger, if I was 20, I don't think I'd be hesitating quite as much. But I think what really concerns me is that I'm so happy. You know, I'm about to start volunteer work now, my study's going well, and I'm really ready to get out in the world now and do stuff, you know, and I don't want to have another year in pain. But even if I could guarantee it was just a year, it'd be fine. But it's all the kind of like, if the revisions need to be done and all of that, and if it really drags on. I've seen with some people it has dragged on. I don't want that to be the case. So I don't know. I really don't know, but I think I'm pretty much ruled out meta, and I think I'm leaning more towards fallow than I once would have done, and that surprises me. You see, a lot of people did say that once my top surgery was done, that I would then be more focused, and they're right, absolutely. I think it was so important to get on testosterone, to have the right hormone in me, to have the right chest, to feel comfortable, and now that I do feel comfortable, I'm ready to look at the next thing. I think my brain's gone, you're not thinking about this yet until stuff's done. And now that I'm in a comfortable place, my brain's gone, yeah, look at this then, thanks. I was talking to Nat yesterday, and it's just like really hit me. Because it was always a case of like, I need to think about this at some point, whether I'm going to do this or not. I'm going to try and explain this as well as I can. I don't know if it's going to come across. I hadn't realised the implications of not choosing. It's not a case of just not choosing. If I'm going to say no to any surgery, I have to actually move into acceptance of that. And the implications of actually just saying no have hit me. Does that make sense? Beforehand it was just like, oh, I'll think about it in the future, you know, I might have lower surgery, I might not, I don't know. But now it's like, okay, if I'm saying a definite no, I have to say no, I have to then mourn for the fact that I won't have that and move on. In order to move on to the next stage of my transition, I need to now make a decision so I can move into acceptance one way or the other. I either say no, not at all, or I say yes to meta and I accept the fact that although I'm going to have something that looks more male, I'm not going to be able to use it functionally more than sitting to pee. Or I'm going to have fallow and have an arm scar, and I have to decide which one I'm going to go for and move into acceptance of that, if that makes sense. And that's really hit me now, that that need is there to make a decision, because by not deciding, that's a decision in itself. So that's where I am with it. So for now, I think it's a case of ruling out one after the other. I'm going to really look into meta and make sure that I am right in thinking that this isn't going to work for what I absolutely want. My absolutely top want and need that I cannot go without if I'm going to do this is standing to be. Something to grab hold of so I can stand to be. And it does look like the meta's ruled out, and if so, then I have to draw a line under that, accept that, move on, and then I have to look at meta and think about how I feel about that. At best, the arms card could go in a year and be okay. It could just be a year out of my life where I'm uncomfortable for a year, but then it's fine. I don't know. But yeah, I'm going to keep talking about this, and it might just be a bit waffly, but I just want to get my thoughts out there. But any feedback from anyone who's had the same kind of difficulty in deciding this would be really, really appreciated. Everyone's helped so much in being honest about their journeys, and I'm really grateful for that. So I'll leave it there for now, but I'm going to do another video soon when yesterday has sunk in a little bit more about why it's changing for me all of a sudden, because it is. So yeah, I'll do a separate video about that, but I'll just say that yesterday was great. Harley Street team are brilliant. Well, I met Dr. Christopher and he is really great. He is a really lovely guy. So yes, that's put me at ease. And I've got more info now. One thing I will say is I've just started reading Hung Jury. And it's made a very good point in the beginning about how the culture in our community is kind of to say that lower surgery is quite bad. And actually that's not the case. It's successful more often than not. Trans men are pleased with it more often than not. Somehow it's got into my psyche that it has a lot of compromises, a lot of problems, a lot of fail rates, and actually that's not statistically true. So I don't know where it's come from, but as it explains in Hung Jury, it's just kind of like gone into the community's psyche, and it's actually not true. So that book's going to help with getting rid of some myths that I've kind of taken on board from somewhere. So yeah, reading Hung Jury now. I've seen Dr. Christopher, that's put me at ease. I'm going to read this Hung Jury, get a bit more realistic about that, and just do some more research and keep you updated. Right, I'll leave it there. Talk to you soon, peeps.